Now, the government has taken the decision to move forward with the National Health Insurance Bill, a plan for a state-run healthcare set to be signed off by the National Council of Provinces. With the aim of achieving universal healthcare coverage, the proposed system faces criticism from healthcare professionals. They argue that the NHI, in its current form, lacks clarity on funding, jeopardizes private health provision, and may lead to an exodus of medical professionals. We unpack the government's push and its implications now with Rob Rose from Financial Mail. Rob, always a pleasure and a good afternoon to you.
Good afternoon.
Rob, I think what's very clear at this point is there's absolutely no philosophical debate about the need for some form of a universal healthcare in South Africa. And you spoke to quite a few healthcare professionals here. Are we all on the same page in that regard?
For sure. I mean, the fact is, as it is, there are a lot of public hospitals and public utilities that are there where people don't get charged for it, but that's been largely left to rot. So I think that part of the frustration is that this is a financing mechanism, but yet our public sector hasn't been managed properly. There is a lot of money still in the healthcare system in the public sector, but it's not managed properly, and that's part of the problem. This NHI is a financing mechanism, but it's quite a wide-ranging one in that what it does is it effectively outlaws medical schemes and makes sure essentially that you and I will pay higher taxes, and the money will then go into a national health insurance fund. From there, that fund will then contract with doctors and medical professionals. So essentially, you'll have one buyer of healthcare services in the country, which will then decide where you go, and it reduces a lot of choice, but it's also the cost that is the real issue. The estimates range from 400 billion to 700 billion per year needed to fund this thing. So that's for a lot of people, that's the crux of the issue in a country that just doesn't have that kind of money. So where does that money come from? And the obvious answer is taxes.
I'm keen to get, some of the other points that the medical professionals and doctors that you would have spoken to raised there. I mean, some of the issues they're worried about is their salaries and their pay and their earning potential as a result of NHI.
Well, certainly a lot of them don't want to be contracted to the state necessarily. And I think that is part of the problem, is that the state will decide who you see. It will, essentially your only client will be the government. And I think a lot of people don't like that. And I think for patients, it's about having choice as to who you see. So I think that's obviously been an issue for a lot of people. The doctors say that the real issue is that this won't guarantee quality healthcare. And they see it as something that is potentially opening up a large tap of corruption, given what's happened to other state-owned funds. If you look at the road accident fund, for example. So I think that's been a concern of many of the doctors. And I think, if you look at the statistics of various polls, the radiologists, for example, I think it was 30-something% of them said they plan to leave because of NHI, and another 23% were unsure. So it's creating a lot of anxiety amongst medical professionals, and I think that certainly the medical aides obviously don't like it because they're going to be driven out of business. But the question is, will this new system ensure quality healthcare for all? And I think that's fundamentally the issue.
What's also interesting is, you spoke to Dr. Nicholas Crisp, who's actually been pivotal in the drafting of this bill. And he did mention the issue of costs. I'm keen to get thoughts on that, on costs overall, Rob. What we do know is healthcare inflation in South Africa does run ahead of a normal CPI. And that medical aid is generally inaccessible to majority of South Africans. And I guess that has been a big motivator here. But I'm keen to get your thoughts on some of what he's shared and why he thinks that this is the right kind of policy to move healthcare forward in South Africa.
Well, I think his view is that essentially that there aren't many resources in the country, and that this is a way of ensuring that the resources in our entire medical sector are shared more equitably. As it is, the figure they keep pointing to is that I think it's something like 51% of our medical spending in the country goes towards the private sector, which looks after 16% of people, and 49% of the resources or the money gets spent on the other massive amount, 84% of the population. So it's that issue. The problem is the financing mechanism, and the issue is that the private sector medical system is funded by people who pay privately for medical aid. But at the same time, that same group is paying the majority of taxes. So 80% of the public healthcare bill is also funded by those same people. So there's a double counting there. And will those people be happy to pay a higher tax under the new NHI system?
I must also then ask you about the health minister, Dr. Joe Phaahla. He mentioned the bill being disruptive. That's a very interesting word to use. Keen to get some more insights on that.
Well, essentially what he's saying is this is a fundamental overhaul of our existing health system. So he can understand, I asked him about the anxiety of the doctors, and he said he can obviously understand that, given that, it does completely disrupt the system. It effectively removes medical aid, and it becomes not a private free market system. It becomes a nationalized healthcare system in which medical aids don't exist really, and you have one single buyer of services. So it's a massive overhaul of the system. So he said in that context, you'll obviously have a lot of people upset about it, and it's quite disruptive. I think the private sector is very worried about what will happen.
There is a big chance that the bill will be passed. I think, it was supposed to be passed yesterday. All of this moved over until next week, Rob. But it will be passed, and then it will be so widely litigated that it will be hard and almost impossible to implement.
Yeah, the constitutional challenges will come from a number of fronts. I mean, firstly, the patients won't really have the right to choose who their professional will be. The medical industry will argue it's their right to contract widely and to essentially choose their client base. And I think that just in terms of the process of this bill going through, there was some discussion in the National Council of Provinces, which is the second House of Parliament that has to pass this. There was a lot of discussion about how the concerns raised in those parliamentary hearings, those NCOP hearings, haven't been reflected in the paper and what was ultimately voted on last week by the individual provinces. So the individual provinces essentially voted to approve this. It now goes to a full vote in the NCOP, and at this point, given the lack of the lack of contest amongst the provinces, it seems likely it'll go through, which would then indicate that it's up to the president to sign it, enact it, and then roll it out.
Well, only time will tell, Rob, and we can only also wonder if all of this is about to do with the election in one way or another. Thank you so much for your time. It's always a pleasure hearing from you. That was the editor for Financial Mail, Rob Rose.